we are now on the brink of an official public health emergency, and this is going to be a worldwide alert. Now, I want to break down what's coming. You may have already heard about this, but it's called Mpox. Now, we are getting the CDC to come out and give statements. They're telling doctors to be on high alert here in the United States. But I want to explain why. What is Mpox? How severe is this? And what are we going to see moving forward? So I'm going to break all this down in just a moment. But all I ask is one thing. It takes 2 seconds. Go ahead, hit that like button if you enjoy these daily updates. And now, let's begin. So let's get right down to it. We are freshly out of a pandemic. Lasted, 3-4 years, right? Millions of people are still highly concerned, some of which are getting infected again due to COVID. But this is what we know. Why a growing Mpox outbreak has the world worried again. It says, amid a surge of cases in Africa, the World Health Organization and African CDC are considering declaring emergencies. The US CDC is urging doctors to be alert. Why? Why is it so serious? Well, let's read a little bit into it. Look at this one. It says Africa CDC to declare first ever continental health emergency as Mpox surges. This is what we need to know. Okay, I want to share some of the facts here. It says that we'll read the first one. The Africa Centers for Disease Control and Prevention, CDC, plans to declare Mpox a public health emergency of continental concern next week, marking the first such declaration in the agency's history. It says the decision follows a surge in Mpox cases across Africa in 2024, matching 2023's total in just 6 months. Okay. So we have already reached the 2023 total so far in just 6 months of 2024. This is why it's a concern. People are experiencing homelessness and inflation and job loss and so many other catastrophes in their countries. And as a result, we see some migration. We've seen a lot of immigrants come into the United States through Mexico and even through Canada. But where they come from, how healthy they are, what their intentions are here in the United States, those are things we just don't know. That's a concern. That's why many health officials are telling doctors to be on high alert, because we are allowing people into the United States, or we travel to other countries, and we could potentially bring back a disease here to the U.S. That's exactly what happened when a person from the Seattle, Washington area brought back COVID from China. I remember this. Okay, you probably do too. Let's keep reading this. It says, since January 2022, over 38,000 cases and 1,456 deaths have been reported. Just this year, 10 African Union states have recorded more than 14,000 cases and 450 deaths, with 2,750 confirmed, 160% higher than the same period in 2023. Says recent outbreaks in Ivory Coast, Kenya, and Uganda highlight the virus's expanding reach. Says Mpox infections in Burundi, Kenya, Rwanda, and Uganda are the first on record in these countries. Again, this is starting. This is potentially moving towards an outbreak. That's a concern. But let's read a little bit of this article from CNN. It says, deadlier strain of Mpox spreads to more countries, raising officials' alarm. Now, I want to get into a little bit of this. Okay, here it is. It says the U.S. Centers for Disease Control and Prevention also issued a health advisory Wednesday to address the risk of additional spread, recommending that physicians maintain a heightened index of suspicion for Mpox in people who recently traveled from the DRC or bordering countries. Again, keep in mind that just because you didn't go to the DRC, just because you weren't at a nearby country, doesn't mean you can't contract the virus. Okay? What you need to understand is that if you are in contact with another person, that has this. That's the issue. And we do not know. Again, try to keep in mind what we went through during the whole COVID years. Right? We were trying to be tracked, and were you next to that person, and was that person next to that person, and was that person next to the one that was infected with COVID, right? And we were trying to figure out the trail. That's the hard part. It's very difficult to do, especially that it's starting in other countries. But like I said before, the issue is that the U.S. border has pretty much been open. This is why it's a problem. Now, I want to read you a little bit more of this, though. Let's read the threat level. It says the threat level right here. It says Clade 1 hasn't been found outside the Central and Eastern Africa to date, but the CDC said clinicians should be on heightened alert for patients who have recently been in the DRC or any country sharing a border with it. It says Mpox, previously known as monkeypox, has risen to 160% in Africa this year compared with 2023. While most cases are in the Democratic Republic of Congo, outbreaks have been reported in 15 countries. Mpox, it causes fevers, chills, swollen lymph nodes, fatigue, and muscle aches, and can be deadly to young children and cause complications in pregnant people and adults with a weak immune system. It says due to a limited number of travelers and the lack of direct commercial flights from the DRC, the risk of Clade 1 importation to the U.S. remains very low. Yes, it does remain very low, but it's not impossible. That is why the CDC is recommending that clinicians do have a heightened alert and are prepared for this just in case. Now, the United States just recently we committed $424 million to the Democratic Republic of Congo. And again, this is the epicenter of this outbreak. So hopefully that does help. But again, is this going to combat the whole thing? Is this going to prevent the United States from seeing an infection? I don't think so. I think it's only a matter of time. But I wanted to share this with you because again, the CDC came out and talked about this just yesterday. Yesterday was when they gave their warning, or actually Wednesday. Today's Friday. So again, it was just a couple days ago. The issue though is we are seeing more and more of these come about. So as we get more information on this, I promise I'll fill you in on all the latest news and updates. As of right now, the concern though is people are coming into the United States and we don't know where they came from. We don't know if they had a connection with somebody that did have the Mpox virus or strain. Again, we don't know these things. And so this is why some officials are saying that we need better testing. We need to screen more people that are coming into the United States, or just shut down the border entirely. So we'll see what happens. But again, thought you would appreciate knowing what is going on, not just here in the United States, but around the world that could potentially affect us here in the near future. So that is what we know as of today. Again, thank you guys for watching. Consider subscribing, and I'll see you guys on the next one.